Our studio guest, Russell Singleton, guest, I got to put a T on the end of that. Russell Singleton joins us this morning from Trip Family Medicine right here in Twin Falls. We call it Better Health with Trip Family Medicine. He'll join us until 9 o'clock this morning. He's also available if you have a medical question or comment you'd like to share. He's available to take that too as well. Bill Colley with you too on News Radio 1310, KLIX, and newsradio1310.com. And Russell, first of all, welcome back. It's been a few weeks.
Yeah, thank you.
The rotation gets larger over there.
Well, I think about once a month because our practice has grown so much. Trying to get everybody over here means I'll probably only get that opportunity once every 4 weeks or so.
We wanted to tell people today we're talking about addictions. Now, you're not commenting on any specific case, but I've got to mention there's a story on the AP Wire this morning about a couple from Jerome who were arrested because it appeared they were driving erratically. They had 10 children in a van with them,
Oh yeah.
and the two of them were taken to a hospital. It turned out that they were both high on prescription drugs, not drugs that would have been bought on a street corner likely. Well, maybe, but these are prescription drugs you normally could get through prescription at a pharmacy. And stories like this are not uncommon. My sister shared with me the other day a friend from high school. Her husband was arrested because he was selling prescription drugs, but illegally. We've got a lot of people who are dealing in this country with addiction problems, and sometimes we don't even know it.
That is exactly where we're going today. And I had read that headline, but admittedly, that wasn't really what uh, drove the topic for me. I was kind of thinking back to that string of pharmacy robberies that we had
Hmm.
at towards the end of 2014. I think we got five or maybe even seven in the area, including that one in Burley. And this new bit of information about that family and those poor kids, I think that just fuels the fire. And this is something we need to talk about. So I have some notes here about drug abuse in general, but we're going to kind of focus on the painkillers, on the opiates. I don't know what drug was involved in this new case with those 10 children. Perhaps we'll find out later, but one of the biggest problems we face in the medical community, and obviously in our own community here of Twin Falls in the Magic Valley, are prescription painkillers. That really was what drove those pharmacy robberies back in 2014.
It seems to me that a lot of people out there, they're looking to self-medicate because they've got an issue or a problem in their lives. They don't expect that it's going to get out of hand. They think in the beginning, well, I can manage this, and then it sort of cartwheels out of control, and the next thing they know, they're in serious trouble. Even if they'd like to change, a lot of them just can't find the way to do it.
Oh, absolutely. In fact, 4 out of 5 heroin users started with prescription painkillers, and I'm inclined to believe that they were prescribed those legitimately, but for whatever reason they became addicted to them. They became dependent on them, and heroin actually is cheaper and easier to get than prescription pain medicine. I guess that's a good thing. At least we're not. At least prescription painkillers aren't what's the easiest to get a hold of. But according to the statistics I was looking at, 4 out of 5 heroin users got started with prescription painkillers.
When we talk about this, when someone finally realizes they have a problem, it's often very late in the game. But the idea is to try to. There's got to be a way to address it. It's all, you can almost say it's never really too late, right? I mean, it's whether you feel you've had a problem for a month or for 5 years. There's still some value in looking for some help.
Absolutely. In the case of these pharmacy robberies, the gentleman Bradley Holcomb, who was actually sentenced to life, claimed that throughout his difficult childhood, he struggled a lot with this, and he eventually was on prescription painkillers, and then it spiraled out of control to where he had an addiction, and he had to fuel an addiction for fear of either missing that next high, or I think more likely suffering withdrawal. So that's when he walked into Walgreens on I think it was November 14th, and walked out the door with over 700 pills, and a lot of them were methadone, one of the strongest, most dangerous prescription painkillers out there. So had someone caught that behavior, whether it was a parent, a loved one, a doctor, a PA, maybe that might not have happened.
we talk about intervention, and that's the key, right? Is finding someone who can convince that person, and oftentimes that person is looking for that, but it's still difficult because the addiction is so strong. They're fighting that versus the knowledge that they need that help.
Absolutely. These medications cause not only psychological dependence, but physiological dependence. And it is incredibly hard to break. It changes the brain. And withdrawal, while actually not fatal in the case of opioids, it is extremely painful. You've got flu-like symptoms, fevers and chills and sweats, but you're also itching and you're agitated and people feel like they're going to die and they'll do anything to avoid that, absolutely. And I think my concern is how we as a medical profession can put a stop to that. Because of course I want patients to accept some responsibility, use these things wisely, but it really has to begin with us, with the medical profession. And the CDC has come out with some guidelines that maybe we'll talk about here in a bit, just a couple of months ago, in an ongoing effort to teach practitioners how to use these more safely.
We've got more on the way in just a couple of minutes with Russell Singleton. He is a physician assistant from Tripp Family Medicine right here in Twin Falls. A Better Health with Tripp Family Medicine this morning on News Radio 1310, KLIX, and NewsRadio1310.com. Russell Singleton joining us in studio today. He's a physician assistant at Tripp Family Medicine right here in Twin Falls. And we're talking about addictions today. And if you'd like to ask him a question or you have a comment as well that uh, dovetails well with our conversation, the telephone number is 7360300. That's 7360300. You're listening to News Radio 1310 KLIX, newsradio1310.com. Bill Colley with you as well. And we call the segment of the program Better Health with Tripp Family Medicine. And we should point out, office is easy to get in touch with, right, too, as well, because you're still looking for new patients as the office grows.
Absolutely. And I want to reiterate that even though we're a full scope family practice, we do a lot of urgent care and we save slots or appointment times for people every day, every one of our providers. So if you call first thing in the morning, you will absolutely get in to see us, or at least have a very good chance of doing so. So call us before you go off to an urgent care and feel like you have to wait in their waiting room for a while.
We'd like to point out, speaking of calling you, sometimes people, when they have an addiction issue, that call's the worst or the most difficult thing to make. Um, but what's the process once you actually get in touch with someone and can work with them?
Wow, that's a great question. Unfortunately, we're dealing with a case like this right now, and I don't want to provide a lot of details, obviously, but uh, I guess I'll say that the patient really hasn't arrived at a place where he's aware that there's a problem, but everyone around him has concern and they think that there's an issue, and so we're actually receiving more feedback from family members than from the patient himself. And in this particular case, we're just having a hard time making that connection because as much as we respect family and appreciate the love and concern that they have, we still have to obey privacy laws, and we can't really we can't communicate with them. We can't acknowledge that such and such a person is even a patient, because even though there's a legitimate concern and we hear that and we act on that, we also can't violate that person's rights at this point.
There's obvious signs, though, I think, to most people, whether it be a family member or it be someone you know at work. We were just talking off air about a fellow I worked with who just stopped showing up some mornings
Yeah.
without any explanation, and it was quite obvious he had a problem.
Yeah, I'm glad you bring that up because that is one thing I wanted to talk about too. What can family and friends watch for in someone who might be struggling with this? And I think you hit the nail on the head. First of all, they start to disappear. They don't show up to known commitments and obligations. Maybe they're sleeping more, they're sleeping less. You might see a significant change in their appetite, in their hygiene. Oftentimes, if someone has taken something recently, you can notice by looking at their eyes, their pupils, the black part of the eye, will be incredibly small, what we call a pinpoint pupil. And it won't react or change to light. That's often a sign that someone is under the influence. But anyone going through those withdrawal symptoms too, that we talked about earlier, those flu-like symptoms, the body aches, the headaches, the chills, the sweats, the itching, the anxiety and the agitation, that is a clear sign that someone is struggling and they need to be evaluated.
Years ago, I read where scientists have determined how addiction is built, connections between the brain. And there was some discussion if they could just find various drugs, they could break those connections. And if they could break those connections, then you break the addiction. We haven't reached that point yet, but I would imagine that there's some treatments out there that you can point to today that are probably far more successful than, let's say, they were 20, 30, 40 years ago.
I think we do have some options actually, and there are a couple of providers. They're very specific and very specialized that prescribe a medication called buprenorphine or Suboxone. Our listeners may have heard of that. It is an opiate, meaning it'll hit some of the same receptors and prevent someone from going into a withdrawal, but it doesn't have that euphoric effect that oftentimes leads people to abuse these. So, an experienced practitioner can use this medication, Suboxone, to basically bring somebody down. But I'd caution that if you go into a situation like this, you have an exit plan. Suboxone is not meant to carry you for the rest of your life. It's meant to be a step down. There's another medication called Narcan or naloxone that basically reverses the effect that these medications have. And in the emergency room, when someone comes in a coma or they start to suffer respiratory depression, we give them this medication, naltrexone or Narcan, and it basically flips the switch back. Ironically, naltrexone or Narcan is now being used as a weight loss medication because it is believed that that rewiring we talked about, some of that similar remodeling is also seen in people who struggle with weight. And if we can help rewire the brain, I guess, or alter these pathways a little bit, we can help people break quote unquote addictions with food and that sort of thing. And outside of opiate abuse, that particular medication is very successful. We're using it more and more in our efforts to help people lose weight.
A lot of these, I was talking to a friend the other day who said that one of his former classmates has become a police officer and that they're all carrying this Narcan almost like a kit. Everyone's assigned it
I
because
believe
they're
it.
seeing so many overdoses. They can quickly administer it. They're trained to administer it, and they can actually bring someone back.
Oh, I believe it. When when we talk about these hundred and almost 200,000 people that have died from opiate overdose in the last 10 15 years, it's usually by respiratory depression. The medication has relaxed the brain to the point where the brainstem forgets to send the signal to breathe, and you stop breathing and you die. And Narcan halts that process and reverses that process, and it very much is a lifesaver. This in off air we were talking about a colleague of mine who actually died due to drug overdose, and I suspect that was very much the mechanism that she took so much to the point where she stopped breathing and died. And Narcan can absolutely reverse that.
There's I had somebody from the criminal side of this in studio the other day, and we talked about how at a place like Twin Falls, which was a sleepy county 20 years ago, we're seeing a lot more of these things go on because we have major highways cutting through the area. That leads to some of this. Population growth leads to some of it. One thing I think that we probably don't address a lot. When we can identify someone with an addiction, then we can try and treat that person with an addiction. But I guess we're not really good at preventing someone from using the stuff in the first place, are we?
That is a great point, and I think that starts with me. I think that starts with primary care doctors and PAs. Some of the statistics I was looking at have shown that as death rates and abuse rates have grown 3 or 4-fold over the last 10 or 15 years, so have prescribing habits. I mean, we're the ones fueling this for the most part, and it's terrible. So I call upon my fellow practitioners to educate themselves, to follow these new CDC guidelines that have come out, which basically, in a nutshell, have said don't use them if you don't have to. Use something else, and don't use the long acting ones, and prescribe them for no more than 3 days because most people just don't need that level of analgesia beyond 3 days. And they said in the same sentence that In rare circumstances, you can go up to 7 days. And if we follow just those guidelines right there, trying to avoid them altogether, using the lowest effective dose for the shortest amount of time, most people aren't going to have a problem. But too many of us, I think, are a little bit too liberal, and hopefully it's because we have a sense of what that patient is suffering, and we're only trying to relieve that suffering. Because there's also statistics that show that we as a profession undertreat pain, especially in minorities. So it's a really difficult thing to balance. On one hand, we're not doing enough. On the other hand, we're going overboard, and I think we're fueling this problem. So we need to give out fewer for sure.
Our guest is Russell Singleton. He's a physician assistant from Tripp Family Medicine here in Twin Falls, Idaho. And of course, we do this every Wednesday between 8:30 and 9 o'clock. We're talking addictions today. Some of these other causes of all of this, and we talk about this increase, this fourfold increase in 15 years, this has a lot to do with just economic issues. People are looking for escape. And and so that larger issue, I mean, I guess it means you're going to be in business a long time treating these things, but some of these larger issues are just simply they will not go away until we remedy some of those other social issues.
I think there's some truth to that. Absolutely. At Tripp Valley Medicine, we've chosen not to participate in chronic pain management, or at least chronic pain management using opiates, because I think we've recognized some of these issues. Now, that doesn't mean that when someone comes in with a broken ankle, that we're not going to give them some pain medicine sufficient to relieve their suffering for a few days. But we have the distinct advantage of having Dr. Tripp, who is a board certified family medicine practitioner, but also a doctor of osteopathy, who has a wonderful skill in physical manipulation. I'm a patient of his right now. He's working on some chronic jaw issues I have, and I'm already seeing some incredible progress. But what he can do with his hands and what he's teaching his other practitioners, myself and Jeremy and Crystal, is amazing. I've had good success with that, and I know Jeremy has too, even recently.
For a lot of people out there, we're trying to change the view of addictions too, though, because it used to always be considered, well, you're a junkie, it's your own fault, and we'll lock them up. But now we're recognizing it more and more as it's a disease. It's we don't lock people up who have cancer or a cold, but a lot of people just simply are in a position. I think about Bob Beckel, the political operative who postponed back surgery a couple of years ago because he knew he had an addictive personality, had struggled with addictions when he was younger, finally got the surgery, and the painkiller sent him right back into that spiral. And for six
Oh,
months, he
wow.
couldn't work and lost his job before finding another. But again, he's got a disease. He's not necessarily a criminal.
Unfortunately, the people who struggle the most with this addiction bill are those who have some other psychological or mental illness. I think that is clear in the statistics. People who are or were suffering depression, anxiety, who have other mental illnesses, schizophrenia or whatever it may be, tend to succumb to addiction much quicker. And until we recognize that factor and do everything we can to improve the mental health in this country, I I think this will continue to be an issue because a lot of these folks probably self-medicate, whether they're using recreational drugs or whether they're abusing prescription drugs. I don't know that they're always looking to just treat that physical pain or put off that withdrawal. I think there's something else. There's some mental anguish that they're trying to treat, and we have to do better at treating mental health. And I don't have all the answers, but at least acknowledging that is a step in the right direction.
And of course, people are going to be different. I smoked cigarettes for a while when I was younger, and when I quit, I just simply walked away. But I have friends who've quit a dozen times and they still can't manage. They keep coming back and keep coming back. Whereas I just simply said, "Oh, that's it. I'm done." And but I don't want to impugn them or give them a hard time about it because I understand it's got to be difficult for them to stop.
And I think that's again where your primary care provider comes in. I think that's where Trip Valley Medicine comes in. We can help these other issues, whether it's smoking or alcohol or some of these mental health issues, we can help work through those. And to say that we don't treat chronic pain or that we don't do pain management is a little bit untrue. We absolutely treat pain, and we treat pain chronically. A lot of our patients struggle with chronic pain, whether it's joint pain or belly pain, whatever, but we do it via other avenues. We do it via things like exercise and meditation. I talked about Dr. Tripp and his uh, manual manipulation. We use antidepressants that have been proven to work for chronic pain. We treat those underlying issues. There are a lot of things we can do to help treat pain. So I don't want anyone to think that we don't treat pain because we do. You have to. But using opiates, especially in the long term, for most people is not a good idea.
We want to point out we're wrapping up today. Tripp Family Medicine, of course, is located on Fillmore Street in Twin Falls, directly across from the main post office. What's the telephone number?
933-4400.
And there's a Facebook page too as well.
Absolutely. And in fact, I just want to encourage everyone too. I think we're still in the voting period for the Reader's Choice, and we would love if everyone went to, I think it's magicvalley.com/choice, if I'm not mistaken, and vote for Tripp Family Medicine under health and wellness, and then again under the category of family practice. But that, I think voting wraps up the end of the month, I want to say.
Hint, hint.
That's right. In a not so subtle invitation.
Yes. We'll talk to you again soon.
Thank you, Bill.
Coming up next, Mayor Sean Beauregard from Twin Falls and spends a few minutes with us. And then we have a guest joining us from Jerome County talking about a big event coming up there this weekend.